So I have the difficult task to keep you energized for the final session. We want to talk about the role of evidence and research in social protection. So we asked our presenters, who are partly here, partly online, I think we have 5, to prepare something we call the Pecha Kucha. I don't know what the Pecha, if everybody knows what the Pecha Kucha is. Like TEDx is a special format, 20 slides that move every 20 seconds, and we realize we're asking them far too late. It's a great format, but you won't probably see today, except someone surprises me. But it's supposed to be more storytelling, more visual. Let's see, because we talk about research, and by tendency, when we talk about research, we have a lot of graphs and points on a slide. However, I got help to set the scene, and we're going to have a 10-minute framing presentation, and then we're going to have one by one some food for thought, some inspiring presentations on different research, and then we call it a day and go into the more social mode, okay? So I have the pleasure to introduce you to the Deputy Country Director of the World Food Programme. She's originally from Singapore. She has worked all over the world for the World Food Programme, brings a lot of experience, has a background in public health as well. And she's going to set the scene in the next 10 minutes. Ladies and gentlemen, and for energizing, I want you to give a big clap that some superstar is coming on stage. Miss Rati Palakrishnan. And we're going to do that with everybody, okay? So not this kind of 3 people clap thing, okay? That doesn't do it. Okay, Rati, the floor is yours. They woke up.
Thank you. And you know, this is really not easy because this session is standing between you and a dinner and cultural show. I won't take 10 minutes because, in fact, the other presentations are more important than mine. And I feel actually like I'm preaching to the choir, given yesterday's Mentimeter, which basically showed everybody knows a lot more than me in the subject of social protection. But just let me just see if I can get this to work. So the significance and evidence and research in effective social protection. So today we'll just really blast through the role of evidence in designing social protection initiatives and the key considerations for policymaking in effective social protection, including adaptive measures to address emerging vulnerabilities like climate change. And I think we all heard about this quite a bit over the last 2 days. So what are we really talking about? Evidence-based policymaking in social protection basically refers to the approach of formulating and executing policies that are grounded in comprehensive research and data analysis. And the second part, in fact, is really important. The second sentence in this slide. Mainly, the methodology enables policymakers to make well-informed choices regarding the most effective strategies to meet social needs, rather than depending exclusively on intuition or political factors. And I think that last 2 words, especially for Pakistan, is really important. And for those of us who were in one of the tables today, we heard a lot about the big elephant in the room, which is the politics of it all. And we really need, as we know, evidence actually knows no boundaries, no barriers, and no politics. So how do we use the evidence to convince the politicians of the right thing to do, or the right choices to make, or the right decisions to make for the people? Yep. So promoting an evidence-based approach, again, what we're looking here for is systematic. We really need to have systematic efforts. And this is important because we need to maximize the quality, the relevance, and the impact. So today, in fact, you'll hear from 4 or 5 of our colleagues who've been with us over the last couple of days, and what they'll talk about, not in this Pecha Kucha method, is really on the real evidence, impact evaluations, assessments, feasibility studies, that this, as yours said, the Pecha Kucha doesn't quite do it justice. So here, the research and evidence generation for filling knowledge gaps. So this is exactly what we're going to hear from Dr. Bhutta and others, communicating this, and that's also why we're all here in this room. How do we best communicate to the policymakers, to the provincial representatives? You know, we heard yesterday, one province will do their own social registry, another one will not, they'll take BESP. Do we need to really reinvent the wheel? The evidence says otherwise. So how can we just push things through? Because there's so much evidence everywhere. Why do we need to start from scratch? And then finally, capacity strengthening. So here, how do we capitalize and most importantly, apply? So what are we going to do with all the knowledge that we've gained over the last 2 days and tomorrow? How do we bring this back to the organizations we serve? Most importantly, the people we serve, right? Let's not forget about the mother and her child. I'm going to skip through these next 3 slides. And then the key considerations. I'm not going to read through this. I think all of you can read. So I'll just pause there for a second. So here, really, it's about integration, using different interventions, context-specific, not a cookie-cutter slice approach, considering the vulnerabilities. And just on this, I want to say I've been here for 3 years, and it's just such a pleasure to see the number of women, especially young women in this room, because I do believe we are the future. So really, really nice to see. And then, of course, using data, we heard a lot about the digital solutions and ensuring sufficient funding. Not always easy, but we also heard about some of the innovative, sustainable financing approaches we could take. But I just do want to leave you with this before I turn to the others. And again, I want to bring it back to, we can't ignore the politics, but we need to really find a way to use the evidence to overcome the politics. Thank you.
Thank you so much. So we need to use the evidence to overcome the politics. That's a good quote. I think I take it away for me for today. And we have 5 presentations. So again, time budget was officially 7 minutes. I know sometimes we don't have the time to test it. So I will give a gentle gong at 7 minutes. I think the virtual presenters won't hear it, just that you have know a little bit where we are in time. And again, when the speaker comes on stage, please give them a big hand. That's like this is the person you have been waiting for all day long, so that they are motivated and you wake up. Okay, so we're going to change the sequence. I'm going with the second speaker on my list. He is a founding director of the Institute for Global Health and Development at the Aga Khan University. Impact evaluation of Benazir Nashunuma program. So please give a big welcome, Mr. Zulfikar Bhutta. That's good.
Spend all my time teaching my students not to do what you have asked me to do, is to squeeze 20 slides in 7 minutes. But I'll try and see if I can get through the message of one of the largest evaluations that are being done for this national support program for nutrition and improvements in stunting in children. So the background to this is pretty clear. Pakistan has one of the highest rates of stunting in the region, and they've been relatively intransigent to change. Rates have been around 40% for a long time nationally, and they vary in various regions from up to 50% in some districts to stunting rates in relatively better parts of the country, which are around 30%. My group has done the 3 serial nutrition surveys between 2001, 11, and 18, and rates have hardly changed over the last few decades. So the government of Pakistan, in trying to address this, came up with this idea of integrating a nutrition supplementation program with the income support program, largely targeting women, and also targeting pregnancy as well as the postnatal period through this intervention. Naveed, was there at the back, was the person behind a lot of this initial thinking. And the thought at that time was that this would be introduced in pilot districts, 9 pilot districts, and they would also have the opportunity to expand once the information was in. But as things happen, the program decided to expand it to everywhere, and as a result, therefore, we had to adapt our evaluation strategy. We undertook 2 approaches. One was to do a quasi-experimental evaluation with propensity score matching at baseline, looking at the intervention districts versus control or alternative districts over time, and that would have a before-after design. But as part of this evaluation, we also thought that we would develop a prospective cohort in 2 districts where you could see things longitudinally. And that has not been done at scale in the country, at least at population level, nested within a program. Now, the important thing was to select these districts according to need. Initially, these districts were selected because they represented where stunting was clustered and largely towards the south of the country. Then as the program expanded, we had to take other provinces on board. So on the slide, you see the intervention and control districts where the pre-post design has taken place. All right, difference approach. I'm not going to go through this. This is the standard way of looking at it, but I'm going to show you some results which are preliminary, and they are from the baseline, midline evaluation. The end line will be next year, and hopefully by that time we would have clarity in terms of what is the direction effect. On the left side of the slide, you would have the overall comparison of control and intervention districts, and on the right side is nested within intervention districts, a difference in difference analysis of looking at recipients versus non-recipients of the program. So keep that in mind as you look at this. So straight away, you can see that there is an impact over time in the midline evaluation of receipt of antenatal care by a skilled care provider. The green arrows show you the direction of the effect and also whether it's significant or otherwise. So pretty interesting. You also have quality antenatal care, which has gone up in these districts as a result of the intervention per se, and that is because the program is integrated with the receipt of education around antenatal care within the primary care facilities. There has been not a huge, but an interesting direction of effect on facility births. Now, obviously, you would look at this in comparison with secular trends as to what is happening to facility births and skilled birth attendants in the country. Now, we were interested in what people were spending the money on within these intervention households, and quite clearly, with the extra money and the education, there is proportionately more spending on food. And this is food basket, separate from the commodities that are being provided. This has an impact on dietary quality. Now, we don't have a ton of indicators for this. We have dietary diversity and minimum meal frequency as one indicator for infants and young children. And there is, across those types of evaluation, an impact in improvement of diet quality referred to here as minimal meal frequency. Now, the rubber hits the road when you look at outcomes. Did it make a difference to outcomes? Now, in the pathway of stunting, being born small is one of the first intermediate outcomes. So this has a pretty massive impact if you take in terms of proportionate rates of reduction over a short period of time to get a 3 to 4% reduction in low birth weight within a short period of evaluation is quite impressive. And it would be very interesting to see if the effect is maintained. There are effects on nutrition, like reduced bottle feeding rates, which means commensurate increases in breastfeeding, and also, interestingly, an impact on immunization status with a reduction in the proportion of unvaccinated children. Remember, there is no direct vaccination intervention. All these women are receiving is at the time when they receive the cash transfer and they go to the facility is some education and some tutoring in terms of the importance of vaccines. Now, did it make a difference to nutrition? Now, low birth weight is birth outcomes. But what about stunting under 24 months of age? And you see a reduction in stunting, at least in the DID analysis, of about 6% over this period of time, which if you roughly translate into is double the exemplars level of 3% annual rate of reduction in many places. So good. This is the first time that we've seen a program impacting stunting. Underweight, same direction. Now, very quickly, I'm going to show you some results from the cohort study. Now, this is the gold standard in terms of longitudinally measuring outcomes in the same families in comparison to those who did not receive the intervention. Very difficult to do because it's BISP recipients, and they get more money if they get the food. So keeping and retaining families within an experimental cohort over time, when there is a disincentive for them to stay in the study, is a big challenge. So we had to oversample the non-BNP households in order to ensure that we at the end had a comparable proportion. So that's one of the reasons why when you look at this, we have more sampling in the non-BNP group because we expected a lot of proportion to drop off, and that's why the drop-off rate in that group is around 40–50%, but we still end up with 2,000 families that you can compare across both groups. They're comparable in household food insecurity at enrollment and at many criteria that you see here by education, by age, and also by the age at recruitment within pregnancy. Two types of analysis per protocol and an intent to treat analysis. The intent to treat analysis is what we look at, which is really everybody and not just a selected subgroup. So I want to show you some outcomes in this summary slide for things that are related to pregnancy outcomes: miscarriages, stillbirths, and preterm births. Now, these are birth outcomes that are generally quite problematic in our population. And if you look at the graph as such, there is a clear indication that outcomes are better in the cohort that has received the nutrition intervention in pregnancy. And although I'm not showing you, there is a dose-response relationship that has persisted so far, and hopefully by the time we finish, we might be able to show that in terms of the value of early recruitment. If you look at the per protocol and ITT analysis in terms of low birth weight, we see a reduction in low birth weight. I mean, a 5 percentage point reduction, which translates into close to around a 7% reduction overall, is pretty impressive and pretty remarkable for a large-scale program. And same you see for underweight, stunting, and wasting. So let me summarize by saying that to someone like me who spends all his time in research in various geographies, I lead programs in Pakistan, in Canada, and in East Africa, this is the first time that we are seeing an impact on nutrition outcomes of a large-scale program akin to an effectiveness evaluation. But it would not have happened had an external group, the Gates Foundation, not put the money into the evaluation of the program. So typically, monitoring and evaluation is not done with this kind of rigor and outcomes. So the one thing that I want to leave you with is the importance of research in the context of learning from programs, and not in an itsy-bitsy patchy way, in an organized manner which requires resources, but if it works, and if it shows that things works, it's worth its weight in gold, because it can influence policy at scale, not just for the country, but also for most low and middle income countries of the same kind. So thank you very much for your attention. I'm sorry I have to catch a flight, but I'll be happy to take questions if there are any burning questions. But otherwise, watch the space for next year when we show you the final results.
Thank you so, Professor Butta. And just a word on the Pecha Kucha. Definitely wouldn't ask you to put this one, each slide 20 seconds. I cannot read so fast. But thank you so much. So if anybody has questions, Professor Butta, try to catch him on the way out. He has to catch a flight. So maybe you just talk informally quickly. Okay, so the second presentation is also from someone you have already met yesterday. She was actually moderating the final session yesterday afternoon. She will present on a feasibility study on social protection for health and climate resilience, which was funded by the KfW, the German Bank for Reconstruction and Development. So she's a senior consultant for poverty and social protection practice at Oxford Policy Management. Please welcome again, with a big applause, Ms. Mahina Zara. Okay, we know where her colleagues are. Let's try. One more time, please welcome Mahina Zara. Yes, here we go. There was a bias in the corner.
All right, so I discovered the Pecha Kucha format exactly 72 hours ago. When I heard about it, I thought it wouldn't be anything too daunting. Turns out it is. But let's see. can we go to the next slide? Oh, I have a clicker, yes. Let's see if this works. Okay, who's familiar with Mario? Good. So yeah, I believed a lot of people would be. Back in my days, it was something you played on computers. But for younger colleagues like Faiz, he's probably more aware of like Mario Kart and the new stuff. But it feels like a Mario game. What we've been doing with this project. Sometimes it feels like we're Sisyphus, but one must imagine Sisyphus happy. So the objective of the overall project, essentially, or the study, was to develop a program or to design a program to support the long-term climate resilience of Pakistan's vulnerable, essentially through an adaptive social protection program. So the desired state you have is what you see towards the end. It's what we all want in the end. And the starting point is, or where we started essentially towards the end of 2023, was where we have a fragmented system that relies on ex-post, let's say, reactionary measures rather than ex-ante measures. And then we looked into how we would conceptualize this, right? So we needed to have a starting point. So we have climatic impact drivers interacting with non-climatic impact drivers, leading to climate-induced or climate-aggravated vulnerabilities in the social protection and health sectors. We looked into a lot of research on this, so leading to water and food insecurity, so on and so forth. How do we address these vulnerabilities? There are two, essentially, let's say broadly, two systems. Conventionally, we've been looking at it after the effect or after an event occurs, after a shock occurs, which is also good, but how wonderful would it be if we had a system, or if we can move towards a system where we are able to act more in advance, let's say. How do we look into this? There are 4 pillars we know of adaptive social protection, so that's another starting point we had, just in terms of organizing our thoughts or organizing the entire structure of the proposition. And then we also had to look at intersectoral linkages, because it's not just social protection, it's also disaster response and recovery and climate change as well. How did we approach this? So we started off by understanding what the context was. We looked at data availability within BIS. We looked at existing disbursement systems and mechanisms. So the initial part was just looking at what exists. Then we started engaging with actors active in similar initiatives or just embarking upon similar initiatives. We then went into scoping missions in KP and in SIN. So we explored, what integration of social protection needs into ongoing climate risk assessment and climate change modeling would look like, what was being done. A lot of what you've seen here today reflected what was, let's say, in process at that moment. Then moving on, identifying a long list of potential project measures and then developing these further. So developing the proposed program a bit further, developing an approach for targeting and identifying potential beneficiaries, and then finally proposing what the project would look like, what intersectoral cooperation would look like, what all those 4 building blocks would look like. In terms of stakeholder engagement, I lost track at some point, but we've spoken with more than 50 stakeholders, and we continue to have these conversations. Like I said, it feels like we're Sisyphus most of the time. We've done several FGDs. We've continued to do desk reviews and so on and so forth. I'm really racing with this right now. But as you see, our framework for working on this, we also worked against the backdrop of a lot of other activities taking place in the same space, right? So a lot of new things came up every now and then, and they continue to come up, which is very encouraging to see. Sometimes it's daunting as well. But we had to take the leap at some point. We cannot continue to be Sisyphus. So we thought we might as well then settle upon a certain project design, see where we land, right? Because we are working in a space where enough evidence on what an effective adaptive social protection program for Pakistan would look like, it does not exist. We have to still move forward. What we did find through our work was, we have at-risk communities. We had to redefine, we had to re-evaluate how we understand risk. So we started looking at climate-induced risk or climate risk-induced vulnerabilities. So here's what you see in terms of what the at-risk communities were facing. We needed to reconceptualize the role of social protection a little bit and also organize it. So as someone who loves it when things are organized, we had to arrange our proposition against 3 needs of resilience. So prepare, cope, and adapt. So the idea being that we wanted to help vulnerable communities or climate risk vulnerable communities be better able to prepare ahead of the event, cope, and then adapt as well. We also wanted to look into targeting, right? So who do we target? We cannot necessarily rely on the existing registry of beneficiaries within the NSER because there has to be an overlap. There could be an overlap. People who are, let's say, vulnerable because they're poor might not be the same people who are vulnerable because of where they are in terms of their climate risk. So here's the architecture of the proposition in essence. What you see over there are the end beneficiaries that we had in mind, so communities, climate vulnerable, transitory poor, because in terms of climate shock, it's a transitory state. Core beneficiaries. Then you have the program, or I talked about 4 pillars. So we got the program pillar of adaptive social protection here. So the prepare, cope, and adapt windows, as we call them. Preparing through behavior change communication and engagement through awareness raising, coping through cash transfers. So we're looking into horizontal and vertical expansions, and adapting through community grant or community adaptation grants. How do you identify them? We do it through something we're calling the household climate risk assessment, and in a few seconds you'll see what the proposed prototype is going to look like. For once I win against the timer here. Any second now. There you go. So this is what this spatial platform for household climate risk assessment we're proposing could look like. We had to look at the existing data that was available, what was possible. We had a certain idealistic view in mind, but once we looked into the data, we're not quite there yet. So for the time being, this is what we use in terms of data layering approach to identify the hotspots for the beneficiaries that we're looking to target. And then financing being another important pillar of adaptive social protection, we looked into how we could have ring-fenced funding, so that's what you see there as resilience fund. And then the resilience fund is essentially activated in the shorter term for the COPE window through a forecast trigger, and in the longer horizon through a longer horizon forecast. And that's what activates the prepare and the adapt window. And then to top it all off, institutional arrangements being the core or the most important part, because at the moment, like I said earlier, fragmentation in terms of institutional structures, that's something that persists. So we had to have a governance framework or propose a governance framework to sort of drive the entire proposition. And so where I hope, I like to imagine where we've made the leap, we're there almost, and let's see how this works out in the future and what we come up with in a few years, 5 years to be more precise. Thank you.
Thank you. And I owe you one, as you have translated your presentation into a Pechakucha, and you might have noticed she was not in control anymore of her slides. They moved every 20 seconds. So that's how it's done. It's supposed to be a storytelling format. So please give her a hand, because she really... However, I wouldn't recommend that for a real academic presentation, right, as you have noticed. So the next presentation brings us actually to a colleague who's online. It's about the Mind the Gap Assessing Pakistan's National Socioeconomic Registry. She's a social protection economist at the World Bank. I think she's online, correct? Yes, she's there? Okay.
Yes.
Yeah, 1 second. Okay, we are waiting for your face to appear on the screen. Hello, good morning to Washington, D.C., I guess. Is this correct?
No, from Islamabad. I'm on a mission.
Islamabad, that's not that far. So good evening. So please give a warm welcome for the next presentation by Zainab Majoka.
Okay, perfect. Thank you so much. So I didn't set a timer on my slides, but I'll try to rush through these. So the topic of my presentation, it's really assessing the coverage of the NSER, but it's also like a really good example of how we can leverage the potential of the administrative data that we have. And BISP has a lot of administrative data. So I think this can really set the stage of how we can start leveraging that. Next slide, please. So I will just start with a very basic introduction of what the National Socioeconomic Registry is. I know all of you already know that, but just to set the stage on that. So as I said, it's a social registry. It was initially used only to identify beneficiaries for BISP Kafalat. It started out in 2010. Over the years, the coverage has expanded, the use has expanded. Currently, it's being used by 30 programs. It also plays a key role in shock response for identifying and targeting people. Next, please. So it has data on the demographic characteristics as well as socioeconomic data. This data is used to calculate the poverty score for each family, which is then used to identify and target households for different programs. Next slide. It also collects data on like the biometric information. It's linked with NADRA's CNIC. It ensures a couple of things along the delivery chain wherever we need biometric information or we need CNIC. So, like know your customer requirements, everything for the payment systems. It ensures that. It also ensures that there is no duplication. And the CNIC can really ensure that as like the social protection system in Pakistan becomes larger and larger, we would actually be able to see like what are the households that are receiving these different treatments. Next, please. And it covers almost 85% of the population. And that was a big question because this number was coming from the admin data. And we usually used to have like, okay, if in census, this is a population, and if admin data is covering like a certain number of people, so it's really just like a denominator, numerator thing, and it covered 85% of the population. But we wanted to check like, who are the people who are missing? Next slide, please. Okay, so why does the NSER coverage matter? So, of course, like the first thing is it's being used for targeting. It's being used by federal and provincial programs. It's being used by NGO-led programs. 2022 flood response, like it was heavily leveraged for that. And then as we move forward and there is an increasing fiscal burden on Pakistan, it can be used for targeting subsidies. So there lies the potential, and that's why we need to make sure that the coverage is there. Next. So basically, exclusion from NSER means exclusion from safety nets and any other type of support. And that's where like the importance lies of this research question. Next. Okay, so how did we measure the coverage? So first, like we designed a door-to-door survey. It was a 20-minute survey which collected data on key PMT score variable, the poverty score variables. It also asked a couple of questions on people's awareness about the NSER based about like the distance from public services, from like let's say from school, from the nearest store, from the nearest bank, just to get a sense of like where the household is situated. And we also collected the CNIC information. We used a very innovative sampling technique that combined the geospatial data and the population data. And we created these small grids, as you can see there, which actually had like the number of households within each grid were 250 households. When we used a census-based approach to collect data. So every structure within this like triangle that you're seeing, we collected data on that. And we marked those places where people were living as dwelling, and then a follow-up survey was conducted where we collected the information on the PMT score. Next, please. We had a representative sample from all 4 provinces and ICT. Our sample size was around 60,000 households. Next, please. And as I mentioned earlier, that we collected the CNIC information because we wanted to make sure that we can leverage the admin data in the NSER and find matches against those households. Next. So the key findings. The coverage is almost 84%, very close to the official estimate, which was a great news because we could verify that. It also, like, we need to contextualize that. So when we compare this social registries coverage with other registries in the world, the average coverage is 41%. There are only 10 countries in the world that have a coverage that's higher than what NSER has. So excellent job of NSER coverage, and also like just putting that in a global context. Next, please. We find that there are regional differences. Like we do see that, okay, so these bars are not like percentage of households missing. This is the probability function. Like if you live in Balochistan, what is your chance of being missed out from the NSER? So let's say if you are in Balochistan, 26% chance that you won't be in the registry. So the predicted probability is like it calculates the probability function. So we find that it's the lowest, like the coverage is lowest in Balochistan. But we also, again, like taking a step back, we also know that education health utilization is the lowest in Balochistan. So there are all these administrative issues with public service delivery, and there are also terrain issues. But also something to keep in mind that when we are thinking about the coverage rates, what are the complementary initiatives we can take in such contexts? Next slide. Okay. Another good news was that we found that the poor households were more likely to be in the NSCR, and the richer households were more likely to be missing. So if you see, like from the top to bottom, where the number 9 is the richest decile of the distribution, wealth distribution. And we see that, yeah, like if you are in the wealthiest decile, you are almost 30% likely to be missing. And if you are from the bottom decile, it's only 6% chance. But despite that, from the bottom 2 quintiles, we found that 2 million households are missing. And over here, I'm just like flagging this 2 million because all the improvements in the NSCR are going to happen at the margin. We are covering majority of the people, but how do we make sure that we don't leave anyone behind? Next slide. Okay, so one thing that we found was that the level of awareness about NSCR remains low. Like, of course, like people understand what BISP is, but people really didn't know what it means. Like when we asked, like, have you registered with the NSCR? And when we asked them, like, why are you not registered? Like 47% said that they did not know how to register for the NSCR. And it's also like it's kind of strange because in the self-reported data, we only found 60% of people to say that they were registered in the NSCR, whereas when we ran their CNICs against the NSCR, the match came back as 84%. So even when people register, they don't know what they are registering for. Next, please. Then another key finding, which is also like very important as we are transitioning to the dynamic registration system, where now most of the data will be collected through desk-based methods, we found that the dynamic registration center actually does really well in capturing people. But when we look at other indicators, we found that, let's say in urban areas, it does better. But as like households which are farther away from urban centers, as we start looking at them, we see like higher exclusion, where like the door-to-door survey does a better job. Next, please. Okay, so what are the policy implications? The coverage of social registry should align with the objective. So let's say in Brazil, the coverage of their social registry is around 40%. But that's because like they want to cover the bottom 2 quintiles with their social assistance programs. In Pakistan, because we are thinking about like, okay, there is social assistance, there is a missing middle, but then there are also like we want to distribute subsidies in a specific way. So we definitely need like a higher coverage. But do we need 100%? Maybe not. So this like the coverage goal should align with what are the objectives of the programs that are going to be using the social registry. Second, next, please. Then we need to complement the desk-based data collection with other measures. As I mentioned, like we found that desk-based does really well in urban areas and also like in among the households that are closer to the DRCs. But as we move further, we see that its effectiveness goes down. So complementing it with like some sort of mobile registration mechanism where maybe you can have, okay, like for houses that are too far, we can do a door-to-door, or as BISP is already deciding to move to a UC level registration center. So that could also be helpful to really going closer to the households that are far away. Next. Then communication campaigns so that people know, and also having a very clear communication with people who are coming to register for the NSCR. What is NSCR? What does that mean? A lot of times people think that when they are registering for the NSCR, they are registering for BISP UCT. So the clarity in this information is very important so that your respondent or like the target beneficiary knows that, okay, I have to update my data, how often it has to be updated, why it has to be updated, and how updating it does not necessarily mean I'll be included in the program. Next. Okay, so based on that, of course, like we have some policy implications, but it's also like every time you do research, it also opens up more doors and it also raises more question marks. So what we found is that we need more information on how the modality of data collection affects the quality of data. That's one thing that we need to look more into. Then the second one is that based on the data that we have already collected, we can use small areas estimation technique to be very specific. As I showed you in our sampling technique, that we created these grids of 250 households each. So using the model that we built with between like the admin data and the survey data we collected, we can be like that specific that within each grid all over Pakistan where you have people missing. And that's what we are working on right now. And we think that that can really help us to think about, okay, like where the households are missing, what kind of targeted campaigns we need for those, and then we move forward from there and like ensure that people who are the most vulnerable are in the NCR. So I'll stop here and yeah, thank you.
Thank you very much. Talking about the assessing Pakistan's National Socioeconomic Registry and some learning. Thank you so much, and we wish you a good evening to Islamabad. We have 2 more presentations. I know we are running a little bit out of steam, I guess. So stay with me. So we have now one presentation about the climate risk profile for Pakistan. Is he there? Yes. And I think Mr. Sanaullah Hassanzai, he's a technical advisor of climate risk assessment, a climate change adaptation specialist at GIZ. I think he will probably, I think he's in Islamabad, right? I'm not.
Yeah, I'm in Islamabad.
Okay, thank you very much for joining us. The next 7 minutes are yours, and hopefully you can keep the time because we have to finish at 6 o'clock at the latest. Yeah. Thank you so much for joining us. Yeah, over to you.
I understand. Thank you very much for this opportunity. So my name is Sanaullah Khan. I'm one of the technical advisors, climate risk assessments at GIZ Pakistan and the Energy, Climate Change and Just Energy Just Transition Cluster. And today I'll be presenting the climate risk profiles that we developed with Post-Time Institute of Climate Impact Research.
I'm sorry to interrupt you, but your connection is not stable. We can't really 100% hear you. Is there any? I'm just checking with the tech team if we can do something from our side. He has to use a mic. You have a mic?
Can you hear me? Can you hear me now?
Yeah. Can you continue speaking a little bit more?
Yeah. Am I audible now?
Okay. Let's try one more time. Yeah. Okay.
Okay. So I'll try to speak a bit louder as well. So I'll try to give some of the results of the climate risk profiles that we did with the Post-Time Institute of Climate Impact Research Germany and GCIAC in Pakistan. So for next slide, please. Yeah, so as you can see that climate change isn't about future projections, it's affecting our very daily life, and we don't need to be scientists to see the impacts. And we can see that there are effects, there are scorching heats in summers and unpredictable floods that disturb livelihoods, and there are prolonged droughts that affect agriculture. So we don't need to be scientists to feel the impacts. Next slide, please. But when you are in this room and you have to plan, then these merely having the experience of feeling the climate impacts is not enough. What you need is actually you need to quantify.
Sorry, I'm getting feedback from the participants that we can't understand you. The tech team here is saying that the problem is on your side, probably. Not even the bandwidth, but the microphone side. I'm not sure how we can continue here. Any suggestions?
Just give me a minute and I can solve it.
Oh, can you speak without? Yes. Can you try? No. And our lip reading is also not that good. And we having. Is it possible for you to record the presentations for us until tomorrow lunchtime? Because we can see that you have really prepared a very nice presentation, so that we can. So if you maybe have a good microphone, just record the presentations in the 7 minutes, and we're going to share that at the appropriate time with a good sound. Does it work for you? Because we don't want to lose the presentation, and you have done definitely a very nice Pecha Kucha presentation. Is that okay?
It's okay, thank you very much.
Yeah, so just take the mic, record it with the PowerPoint, and please send it to the GIZ colleagues. They will reach out to you. Can we give him a big hand because he can't really present? So thank you so much, and hopefully we receive the presentation by tomorrow lunchtime. Just do it as you were planning anyhow, but make sure you have the good sound. So have a good evening and greetings from Karachi to Islamabad. And we are going then for the final presentation. This one is a presentation about social protection delivery system on wheels, a case study of mobile registration vehicles in Pakistan. And this one is also delivered by a Director General from our friends from BISP. So I hope, yes, please give a warm welcome to Dr. Asim Ijaz. Our last speaker, the last 7 minutes of the day are yours, sir.
Thank you very much, Jost, for giving me the floor. And I believe that everybody was happy listening that it's the last speaker. So I can feel it. First of all, my apologies for not being there in person because of some critical engagements by the Prime Minister office due to the Ramzan package, though my team is there to represent NSCR. So one thing I would appreciate that an earlier presenter, Zainab Bajuka, was saying that registry needs complementing with the mobile registry. So here I am presenting the same because realizing the critical needs of mobile registry, BISP has designed the same theme. So I'll be presenting the case study on BISP mobile registration vehicles that are revolutionizing the social protection delivery in Pakistan. This is an initiative, a response to the mobility challenges faced by the vulnerable population, ensuring that no one is left behind. So can we move to the first slide? Because I cannot see it here, so I hope it's the second slide. So BISP established 647 dynamic registration centers across Pakistan, but the accessibility remains a major challenge, especially in the remote and far-flung areas. From a recent study that was conducted by the World Bank, it reveals, it was done in 2024, so it reveals that the rural household faces higher exclusion risk, that is 13.6%, as compared to the urban households, especially in case of Balochistan, which is the most affected region. So for that reason, just to eliminate the exclusion risk, BISP has designed this mobile registration system as well. So this highlights the needs for a more mobile, flexible and adaptive registration model. And that's where the MRV's concept came into. Next, please. The registration, I'll give you a little background that with the support of our developing partner, that is GIZ, BISP launched this 25 mobile registration vehicles back in 2023 to extend the registration coverage to the hard-to-reach areas, as I said, about Balochistan and Sindh. These MRVs have broken the traditional barriers to the inclusion by reaching the most marginalized groups, including the women, the elderly, and the persons with disability, which are facing hurdles to reach out to our dynamic registry centers. So this innovation is not just about mobility, it's about ensuring every Pakistani has equal access to the social protection system of Pakistan. Next, please. Just to highlight that total of considering the areas, the 18 of the mobile registration vehicles are deployed in Balochistan, 5 in Sindh, and 1 each in Islamabad and Khyber Pakhtunkhwa. You can see that the geographic spread actually ensures that marginalized population in disaster-prone, climate vulnerable and conflict-affected regions can access the services of BISP through these mobile registration vehicles. This targeted approach aligns with the global best practices in shock responsive and adaptive social protection. So next, please. Since October 2023, because when we procured these vehicles and deployed in field, the MRVs, the registration so far made through these MRVs are about 117,000 households that have been registered through these MRVs. And out of these 117,000, about 77,000 were the disaster surveys because of the engagement in the region of Balochistan and Sindh. So 77,000 are those who are surveyed in the disaster-prone area. So this data underscores the rapid response capability, particularly in time of climate shocks and disasters, by reaching to the population where the traditional model of DRCs get fails. MRV have reduced the exclusion errors, as I earlier said, that it ensures the accessibility to all the vulnerable community and the segment. So next, please. About the impactful investment. What actually makes MRVs a good investment? The three key factors are like the accessibility, the cost effectiveness, and the rapid deployment. Specifically, when I talk about the cost effectiveness, we have done the ROIs for MRVs, and we've reached to the conclusion that over a time of 5 years, the ROI is 1.5 times. 1.52 times of its cost. So MRVs actually eliminate the opportunity cost for registration, reducing the travel expense, time loss, and wage losses for beneficiaries. Specifically, when we talk about the challenge segment, who are like daily wagers, and when they leave their job and come to the DRCs, they spend all the day. So instead of that, the MRVs, while reaching to them, at one stage, it actually reduces the cost of their travel, and at second point, it's actually giving them the leverage that they keep carrying on their duties. So it's reducing the time, the cost, and the wages loss as well. So compared to the static centers, MRV bring the services to the people at their doorstep rightly, and making the social protection truly accessible. So having said it, I'll be giving a way forward as well. So next slide, please. BESP is now expanding the MRV fleet by adding 5 more vehicles to reach out the underserved community. So collaboration with NADRA will allow MRVs to provide additional services to the child registration, CNIC issuance, and critical documentation support, because at time we feel that these MRVs will be equipped with the NADRA staff as well, so that it can work as one-step services provision as well. So to ensure the real-time connectivity, we are now introducing the satellite internet in MRVs as well, enabling seamless data transmission in remote areas, so that we do not face any more connectivity issues. So at the end, I would say that the success of MRVs proves that the social protection must be mobile, as my earlier presenter Zainab Majuka said. So it must be mobile, adaptive, and inclusive. So MRVs are not just vehicles; they are bridging the inclusion, resilience, and dignity for those who need social protection in most. So expanding MRV services across all social protection agencies will not only increase coverage but also drive efficiency, impact, and long-term sustainability. So by this, I will invite all my development partners to collaborate in scaling up this initiative, ensuring every household in Pakistan has equal access to the safety net that deserve. So together we can make social protection accessible, efficient, and future ready. As GIZ has contributed in it, so I must applaud them for our accessibility through MRVs to the far-flung areas. And same wise, I expect that our rest of the development partners will also come forth for further strengthening this MRVs in the far-flung areas. So with this, thank you very much for being patient. And if there's any question, I'm available too. My team is there. My NSCR team is there who can respond to them. Thank you very much, Jost.
Thank you so much, Dr. Asim. Please give him a hand. I think it was a very inspiring story, Dr. Asim, and I think we all see the value of mobile registration vans and that we probably need a little bit more and upgrade so that we reach everybody. So this concludes day 2. Everybody who is here, you managed to stay until the end, but it's not 100% the end of the program today. We have the dinner, so I would request everybody to come to the pool area at 7 o'clock. Dress code is as you see fit. Again, it's not in the pool, next to the pool, so there is a limit of dress code. And we're going to have barbecue. Going to have a show. We have a colleague from BIS who's starting a second career as a showmaster. We have music. And we're going to stay together from 7 to, I think, up to 9:30, I think. That's the official time. Because if you are having a pool view, you might, even if you don't want to join, you join somehow. So I think the next 2.5 hours from 7 onwards is a social part. Maybe you should not miss it. And reminder, if you haven't given the GIZ people who have been funded by GIZ the boarding passes, please see the people at the registration at the latest tomorrow. I think now there's nobody there, but tomorrow they're still there. They still take boarding passes. The cultural event is from 7 to 11. Okay, so you're allowed to stay awake until 11, but you have to be back on time tomorrow for day 3. Okay? Any last announcements? I'm looking at my colleagues. So thank you so much for participating. And we're going to continue tomorrow, 9 registration open, 9:30 continue. And we have some interactive formats, some more presentation tomorrow. And we will also present the results of the draft statement and have a World Cafe style conversation about the way forward. So with the power given to me, I let my colleague Shua, who was actually working in spite of not feeling that well, and she's very happy that day 2 is over. See you tonight or tomorrow. Thank you very much.